Hello everyone. Welcome to today's video. We are going to talk about serotonin. Serotonin is a chemical messenger, which we commonly call them neurotransmitters. Serotonin is also considered as one of the autocoids. This is a chemical name for serotonin, 5-hydroxytryptamine. And on the right side of the slide, you can see the structure of serotonin. And before we look at the pharmacological overview, we're going to look at history of serotonin biosynthesis and its metabolism. But maybe breaking down the pharmacological overview, we start with the example of a drug or a typical chemical that we're talking about. Then we look at its indications. That means that where it's being applied or which condition is it used for. Then we look at the mechanism of action, how does it act in our bodies, and then we also look at the contraindications, which means which situations a chemical should never be used or it should be used with caution, and as well as adverse reactions, which are the side effects of those particular drug or chemical. Well, let's proceed and look at history of serotonin. Serotonin was first discovered in 1930s by a guy known as Vittorio Espama. He named it interamine because it plays a very huge role in gut motility. In the 1948, scientists at Cleveland Clinic, led by Maurice Rapport and Irvine Page, they isolated the compound and then named it serotonin because it had a very big role in serum tonic effects, which work by constricting blood vessels. And something when it's tonic, which means it brings about healing. In the 1950s, it was now identified as 5-hydroxytryptamine. This chemical identity was confirmed. But late in the 20th century, research was done on it and it was uh, declared as a neurotransmitter. And it was discovered that it has a very huge connection to mood and anxiety. And also, it's through this 20th century research that led to development of selective serotonin reuptake inhibitors, which we will look at them later. They are used for treating depression. So, without wasting time, let's look at serotonin biosynthesis and metabolism. Serotonin is being made from a protein, or I would rather say an amino acid, which is tryptophan. To be specific, L-tryptophan. L-tryptophan is converted into 5-hydroxytryptophan by hydrolysis through the enzyme known as tryptophan hydroxylase. This intermediate is then converted into 5-hydroxy, into serotonin through decarboxylation by 5-HTP decarboxylase. This is basically the biosynthesis. And then we can look at the breakdown. The metabolism of serotonin is in two ways. So on the right side, we have the breakdown of serotonin into 5-hydroxydole acetaldehyde, which is being catalyzed by MAO, the monoamine oxidase. The process is oxidation. And then later, the intermediate 5-hydroxydole acetaldehyde is converted into acetic acid, 5-hydroxy dole acetic acid, through dehydrogenation by the enzyme aldehyde dehydrogenase. So don't forget that serotonin can also be used to make melatonin, which is a very important compound in inducing sleep. So, and that's what's happening on the left branch of the metabolism of serotonin in the diagram. So, serotonin is converted into N-acetyl serotonin. by the enzyme alkyl, that's aryl alkyl N acetyltransferase. And then the N acetyl serotonin is converted into melatonin now by N acetyl or methyltransferase enzyme. So next we will look at the receptors. What are those receptors of serotonin? We have seven classes of serotonin receptors. Class 1, 581. Then class 2, class 3, class 4, class 5, class 6, class 7. For class 1, we have a typical subclass, which are 5: A, B, D, E, and F. For serotonin receptor class 2, we have subclasses A, B, and C, as well as the rest. But we are going to focus on the major ones. So, for their mechanism of actions, I have a very, very understandable, quick mnemonic. So, which goes this way: 1 represents the class. So, for class 1 receptors, they inhibit. Remember that these receptors of serotonin, they work by either inhibiting or stimulating. So for class 1, they inhibit CMP. If you see GI, it means inhibition of CMP. Class 2, they excite IP3. If you see GQ, it means excitation of IP3. Then we have class 3, which is, of course, a channel. If you see receptor class 3, remember that, and it's actually the only ion channel or ion uh, ligand gated channel receptor that we have in serotonin receptors. For 4, 6, and 7, it stimulates or they stimulate CMP. Then lastly, 5, which works the same as 1, they inhibit the CMP. Next, we're going to look at their respective functions, distributions, and effects. So for class 1A as well, we've said they inhibit CMP. They are distributed in rough nuclei and hippocampus. They take part in sleep regulation, feeding, and anxiety. For class 1B, they do the same. Mechanism of action is just the same, which is inhibition of CMP. They are distributed in substantia nigra, globus pallidus, and also in basal ganglia. They take part in neuronal inhibition and behavioral changes. For 1D, they do the same work by inhibiting the concentration of CMP. They are distributed in brain and they take part in vasoconstriction. Don't forget this, that 1B and 1D are known as the triptans, and they are commonly used as anti-migraine drugs, or they are used in anti-migraine. So for class 1E, they also inhibit CMP. They are distributed in the cortex, hippocampus, and their effects are memory. For 1A, they do the same. What have you noted? All the one class receptors, they take part in or they work by lowering the concentration of CMP. That's their mechanism of action, actually. So 1F is distributed in globus pallidus in putamen. It has effects of anxiety and vasoconstriction. Next is class 2A of serotonin. They take part in uh, raising or increasing or stimulating IP3. So they are distributed in platelets and also cerebral cortex. So their effects are cellular excitation, muscle contraction. Yeah. For 2B, they also stimulate IP3 and they arrest in stomach. So the effects are in appetite. For 2C, they take part as well in stimulating the concentration of IP3 and they are distributed in hippocampus and substantia nigra. So their effects is anxiety and then the only ion channel receptor, which is 5-HT3 receptor or serotonin receptor class of number 3. They work by stimulating or acting on the sodium potassium ion channel. They are distributed in area postrema and also in the enteric nerves. They highly take part in vomiting or the effects is emetic. For class number 4, they stimulate. Now, their effect is opposite to the one for class 1. They stimulate CMP, they are distributed in the cortex, smooth muscles, they take part in gut motility. So, class 5, A and B, they perform the same function, they take part in the locomotion and sleep. They work by lowering the CMP concentration. Now they work the same way as class number 1. So number 1 and number 5, they work the same way by reducing the amounts of CMP. They are distributed in the brain. For class number 6, they stimulate the concentration or increase in the concentration of CMP. They are distributed in the brain as well, and then they take part in cognition and learning, the last class, which is number 7. They also stimulate CMP. They are distributed in the central nervous system. They are the custodians in sleep mode and circadian rhythm. Let's now look at the general functions of the serotonin receptors. Generally, class 1 are located in the central nervous system. They are involved in inhibition and they can also be anxiolytic, which means they reduce anxiety and they take part in anti migraine treatment. Basically, the triptans, the class 1B and also 1D, and 5-HT2, they are distributed in the CNS, smooth muscles, and platelets. So they are used in hallucinations and vasoconstrictions. For class number 3, they are distributed in the CNS and also in the gastrointestinal tracts. So, in which they take part in emesis, vomiting, and also pain. For class 4, they are distributed in the GI tract as well and also heart, where they also participate in motility. 5, 6, and 7, they are distributed in the CNS. They take part in cognition and circadian rhythm as well. So next, we are going to look at the agonists of these serotonin receptors. So for one, uh, generally, especially if we're to talk of 1B and D, we have triptans. Examples are the somatropin or simatropan, then the risatripan, and then you have the zolmitripan. So it depends with how you pronounce them. But I do this way. I say somatripan, then risatripan, and then zolmitripan. So for 1A to be specific, 1A is bispirone. So someone can call it buspirone. These are the examples of agonists to their respective receptors. And you really need to remember that for first point or first line, 81 agonists, this one is basically on 1B and 1D class. So for 5-HT2 agonists, so example is LSD, which is used as hallucinogen. Then for 4, we have the Caesarpride, then we have the Tegaserot, which is prokinetic. So when something is prokinetic, it takes part in GI motility. And what are the indications of these agonists? Triptans, they're used in acute migraine and also cluster headaches treatment. So, buspirone, they are used in general anxiety or generalized anxiety disorder. For Caesarpride and Tegaserot, used in the treatment of GI motility disorders. This is where they are used. We also have the experimental ones or the psychedelics, which we will maybe discuss later. So they're used in research, carrying out research on depression and also in the treatment of PTSD, the post traumatic stress disorder. And what are the actions? What are the actions? How do they work? That's what we mean. How do these agonists work? For IT1, they work by inducing cranial vasoconstriction or inhibition of neuropeptide release. IT1A, they are partial agonists though, but they also take part in lowering anxiety. Hence, they're anxiolytic. For HT2 agonists, they take part or they induce their actions by hallucination or altered perceptions. So for 4, very clear, straightforward. It's all about enhancing GI motility. Let's now look at antagonists, people who work against serotonin. They are here. For antagonists, for receptors group 2, we have the ketanserin, we have the risperidone, and then we have the clozapine. So for antagonists of receptors group 3, we have the ondansetron, then granisetron, and then we have the palonosetron. For 4, we have the brocalopride, which is a selective agonist, and it's also an antagonist. Take note, this brocalopride is a selective agonist and also an antagonist. Then we also have some of them that are non-selective. So they don't choose which receptors. These antagonists are 2. We have the methysaggide, then we have the cyproheptadine. Next, we are going to look at indications of those antagonists. What are they used for? For blockers of or antagonists of class number 2, they are used in the treatment of schizophrenia, psychosis, and hypertension. 5-HT3 blockers used in chemotherapy induced nausea or vomiting. Also for postoperative nausea. If you've ever been to theater, you can bear witness with me that after the operation, you feel like you want to vomit, especially when you are walking up, and if you want to stand up or sit upright, you feel like you want to vomit. And this is where we need HT3 blockers. I mean, serotonin receptor class 3 blockers. Very important because the class 3 are the ones that induce the vomiting thing. So for cyproheptadine, uh, they are used in the treatment of, I mean, migraine, or they are applied as prophylaxis for migraine, and also as well as serotonin syndrome. Serotonin syndrome is when there's a very elevated levels of serotonin in the body, and then in allergic reactions. Yeah, and lastly, we look at an antagonist called methysaggide. It's used as a migraine prophylaxis, but its use is limited because it has a very, very concerning side effect. fibrosis. So, what are the actions of those antagonists? For 5-HT2 blockers, they reduce hallucination and they also cause vasodilation. For 5-HT3 blockers, they block vagal stimulation. They prevent nausea or vomiting. For cyproheptadine, they are antihistamine. Okay, they block histamine mechanisms. They are antihistamine as well as anti-serotonin actions, uh, blockers. So for methoxsagate, they act in long-acting serotonin antagonists for migraine prevention. That's what they do long term. It's a long term thing. It's used as a long term to prevent migraine, which means it's used as anaphylaxis for migraine. So, what are the contraindications? So, the contraindications for triptans: ischemic heart disease, uncontrolled hypertension, or cerebrovascular disease. For buspirone, severe hepatic or renal impairment. So, if you see someone having the impairments in either of the two organs, the heart or the kidney, then you shouldn't give them this drug. So for contraindications of 5-HT3 antagonists, you need to take caution in patients with the prolonged QT interval syndrome. So for cyproheptadine, take caution in glaucoma and also in the elderly individuals or patients where they get to cause anticholinergic effects. What are the adverse reactions? For triptans, they cause chest tightness, uh, paresthesia, and dizziness. For buspirone, drowsiness, they cause drowsiness, then headaches, and also nausea. For cisapride, it causes arrhythmias, which is QT prolongation. And for LSD, they cause hallucinations, anxiety, and psychosis. Yes, adverse reactions of the antagonists: 82 blockers, sedation, weight pain, metabolic syndrome, antipsychotics, that's what they do. So for HT3 blockers, they cause constipation. This is side effects. When you use them, you have to understand that this is what you're going to experience: constipation, headache, and QT prolongation. For cyproheptadine, it can cause sedation as a side effect, dry mouth, blood vision. For methylsagate, it can cause uh, uh, retroperitoneal fibrosis. I think I have mentioned this one previously, that a long-term use of this drug can cause fibrosis, and it's specifically retroperitoneal fibrosis. Here, we will look at a very quick summary, an overview, a brief one. Then from here, you may have learned that the greatest influence in our bodies from serotonin is on the mood, appetite, sleep, pain, and GI motility. Agonists are used widely in migraine, anxiety, and GI disorders. For antagonists, they are used in psychosis, nausea, and also as migraine prophylaxis drugs. Take a note that there's a risk of serotonin syndrome with combined serotonergic drugs. And I said serotonin syndrome is when there's an abnormally elevated levels of serotonin. Be careful when you are giving these serotonin drugs, because uh, patient selection is required. These drugs have adverse effects and health risks, especially in the cardiovascular and in the central nervous systems, if not used appropriately. Thank you so much for sticking to the end of this video. It is a very long journey, 25 minutes, not a joke, even me recording this. And I want to congratulate you and also appreciate you for sticking to the end of this video. I hope I said something very important to you. And if I did, please subscribe, please comment, and please share this video with the relevant people so that I can keep on being motivated to create more videos like this. Tell me in the comment section what do you want me to talk about in the next video. Goodbye. Have a good day.